Welcome back to Poultry Vet Doctor channel, where we dive into the fascinating world of poultry health, production, diseases, nutrition, and drug review. Greetings, poultry enthusiasts. Today we are diving deep into a topic that concerns every poultry keeper: low egg production, how to identify and treat the 25 causes. Join me on this exploration as we uncover the myriad factors that can impact your flock's egg-laying prowess. It all starts with what goes into the beak: the quality and quantity of feed. When we talk about the quality of feed, we are talking about the right composition at the right inclusion rate, which means that the right quantity of maize or wheat bran or soya should be given at the right rate for the particular stage that the birds are. Meaning, a layer 1 feed should not be given to a bird at a grower stage or layer 2 stage. Also, the right amount of crude protein, nutrients, amino acids and other vitamins in the feed should be all at the right proportions. When we talk about the quantity of feed, ideally for a matured bird, it's supposed to eat between 115 grams to 120 grams per day. But each stage has its own feed requirement. So feed should be given at such rate and shouldn't be underfed, which will affect the egg production, and overfed, which can lead to fatty liver, extra abdominal fat, which can also bring complications. Also, change in feed. Sometimes the change in feed can also affect the laying and cause a drop in the production. Other factors include not giving them enough drinking water. It can also affect not just the quantity of the birds, the egg size, but it can also affect the egg size. Also, decrease in feed intake, or when there is no available feed. So with some farms, sometimes almost half the feed can go on shortage and there will be no feed for the birds maybe throughout the rest of the day. Sometimes because of an infection, there is decreased feed intake, which all affects or causes low egg production. Ensure a balanced diet with high quality feed and gradually introduce any changes to avoid disruption. Monitor feed consumption and adjust portions sizes to meet the nutritional needs of your flock. Avian encephalomyelitis causes inapparent infection or drop in egg production in laying hens, mostly due to inadequate supply of certain minerals and amino acids. Vaccination and strict biosecurity measures can help safeguard the flock against this viral nemesis. Newcastle disease is not just about paralysis. It has impact on egg production. By weakening the bird's overall health, it affects the ovarian follicles, usually show lesions ranging from hemorrhages, congestion, hyperemia, necrosis, and atrophy. This explains the drop in egg production, and recovered birds may not return to lay early. Also, the fall in quality of eggs is because the fever that accompanies the disease causes the egg to pass through the oviduct at a faster rate, resulting in defective calcification of eggs and soft shell eggs, which is abnormally shaped eggs. This same rapid movement also results in defective pigmentation of the eggs, called bleached eggs, which is mostly the first sign of Newcastle. Infectious bronchitis, a familiar foe, can lead to a decline in egg production due to the fact that the disease affects the reproductive tract. In the absence of good levels of maternally derived antibodies, infection in chicks causes permanent damage to the oviducts with a reduced future egg production and appearance of what we call false layers in the flock. False layers are birds that do not lay and are healthy, they are not sick, and they are just in there eating your feed, but they have no egg follicles to lay eggs for you. In laying flock, a decline in egg production and quality is observed. Decline may be up to 50%. In most cases, 4 to 8 weeks may elapse before egg production returns to pre-infection levels, but usually never attained. Eggs are usually discolored, rough, soft shell, misshapen, and hatchability of eggs are usually low. Vaccination can be effective, but quarantine and strict biosecurity measures are essential for protecting your feathered companions. Avian influenza. This viral heavyweight can affect egg laying in all ways, and a precipitous drop in egg production is the number one rule. Strict biosecurity measures, including quarantine and proper sanitation, are crucial to prevent its spread and mitigate its impact on your flock. Fowl cholera, a contagious disease that affects egg production by causing illness, mostly affecting the intestines, reducing absorption, which automatically goes on to affect the egg production. Antibiotics prescribed by a veterinarian, along with biosecurity measures and proper sanitation, are key to managing this potentially devastating disease. Sometimes it's the simple act of not eating or reduced consumption of feed that causes the drop in egg production. Lack of food leads to low egg production due to the inadequate nutrition. Ensure that a consistent supply of nutritious feed is made available to the birds, and monitor for any sign of illness or stress that may affect their eating habits. Remember that the birds will always maintain before they produce, maintenance before production. So small amount of nutrients that they will get, they will use it for maintenance and not for production. Avian tuberculosis, an internal challenge that affects egg laying by compromising the bird's overall health. The formation of granulomas or tubercles can sometimes affect the egg follicles, which will also go on to compromise the laying ability of the birds. Proper management, including culling affected birds and maintaining clean living conditions, is essential to prevent its spread. Enter the spiral world of avian spirochetosis. This bacterial invader affects egg production by causing illnesses in affected birds. Antibiotics prescribed by a veterinarian and strict biosecurity measures can help break free from the spiral. Fowl typhoid, a bacterial nemesis that reduces egg production by causing illness in affected birds. It is an acute or chronic septicemic disease that affects mostly adult birds, but it can also affect young birds. There is a drop in feed consumption and subsequent drop in egg production too. The lesions are predominantly in the gonads. Affected follicles are deformed and appear pedunculated mass. So therefore, it will be very difficult for the eggs to drop, to go throughout the whole shelling and egg formation process, leading to drop in production. Egg drop syndrome, a mysterious egg decline. This curious phenomenon leads to a decline in egg production due to reproductive issues in affected birds. Proper nutrition, management, and vaccination against causative agents can help prevent its occurrence. Ulcerative enteritis, a gastrointestinal challenge that affects egg laying by causing gastrointestinal issues in affected birds. It is caused by Clostridium colinum, an organism that is highly resistant to chemical reagents. There is formation of deep button-like ulcers made in the intestines, therefore compromising the integrity of the intestine, limiting absorption of necessary nutrients to help in egg formation, with the end result being a drop in egg production. Antibiotics prescribed by a veterinarian and maintaining clean living conditions can aid in recovery. Necrotic enteritis, a bacterial intrusion that impacts egg production by causing illnesses and gastrointestinal issues in affected birds. This is mostly seen by severe necrosis of intestinal mucosa. There is damage to the digestive tract, which results in reduced absorption, just as in ulcerative enteritis. You can reduce fish feed meals, reduce cocci, control cocci, and include probiotics in your feed to help prevent and also treat. Mostly go with antibiotics prescribed by a veterinarian. Strict biosecurity measures are necessary to mitigate its effects and spread. Recently, you can also use Bacterial to vaccinate against Clostridium perfringens. Fungus can be a formidable foe. Fungal toxins in feed can lead to a decline in egg production. Ensure feed quality by storing it properly and regularly checking for fungal contamination. Shedding light on the situation. Inadequate lighting can disrupt egg laying patterns. Averagely, a mature bird needs about 18 hours of light. Minimum 16 hours is okay, but anything mostly below that can affect or disrupt the egg laying patterns. An excessive amount of light too can equally affect and stress the birds. So therefore, provide consistent and appropriate lighting conditions to stimulate egg production. Fatty liver hemorrhagic syndrome, a nutritional challenge that results from poor diets and can decrease egg production. Ensure a balanced diet and avoid overfeeding to prevent its occurrence. Age is more than just a number. Egg production naturally declines with age in hens. Consider rotating older birds out of production and replacing them with younger ones to maintain productivity. Stress and high temperatures, a double whammy that can disrupt egg laying. 1. The stress can compromise the immunity of the birds, making them susceptible to any form of infection, which can also affect their egg laying. Stress also affects the birds' ability to eat and drink at the right quantity that is required to enhance proper egg laying. High temperatures or heat stress can frustrate the birds and prevent them from eating and drinking to help in the production of birds. Sometimes when the temperatures are extremely high, it can result in the death of many birds. Provide adequate shade, ventilation and water to keep birds cool and stress-free. Sometimes it's the fear factor. Fear from egg-consuming predators and chicken, especially those with a taste for eggs, can lead to low egg production. Implement predator-proof measures and provide secure housing to minimize stress. Eggshell gymnastics, excess breakages. Mishandling eggs can decrease overall production. Train staff on proper egg handling techniques and invest in equipment to minimize breakages. Shedding light on vitamin D. Deficiency in this essential vitamin D can impair egg production and quality. Supplement feed with vitamin D. Avian botulism, a paralyzing toxin that can reduce egg production due to illnesses in affected birds. Prevent exposure to contaminated water sources and promptly treat any cases with supportive care. Not all medications are egg-friendly. Certain drugs can impact egg production. Drugs such as sulfonamide can cause regression of egg follicles, which will subsequently result in drop in production. Find ways to navigate medication with your flock. Consult with a veterinarian to ensure that the medication used are safe for laying hens. Certain derailments can also affect egg laying. The weather's influence on egg laying. Extreme weather conditions can disrupt egg laying pattern, such as during high rainy seasons and high temperature seasons. These can cause a drop in egg production. So therefore, provide appropriate shelter and management practices to mitigate the effect of weather variations on egg production. Molting is a natural pause. Molting interrupts egg production as hen redirects its energy towards feather regrowth. Support your flock by providing a high protein diet to aid feather regrowth and reduce stress during this period. Increase lightning to stimulate egg production once the feathers have regrown, and consider rotating or supplementing with young birds to maintain egg supply during molting. A crowded coop and its consequences. Overcrowding causes stress and competition among birds, leading to reduced egg production. This means that overcrowding causes the birds to compete for feed. In such case, most of the birds don't get adequate feed and water, which will enhance egg production. Therefore, provide adequate space per bird in the coop to minimize stress and aggression. Mostly, a mature bird is supposed to occupy 1 foot square space. Regularly clean and ventilate the coop to reduce the buildup of ammonia and pathogens, which can further stress the flock and impact egg production. Overfeeding can lead to obesity and reduce egg production due to hormonal imbalances. Monitor feed consumption and adjust portion sizes accordingly to prevent overeating. Provide a balanced diet with correct nutritional content for laying hens, and consider using feeders that regulate portion sizes to prevent excess consumption. This wraps up our comprehensive journey through the labyrinth of egg production in poultry. Remember, a healthy and a happy flock is more likely to lay those golden eggs. If you found this exploration enlightening, don't forget to hit that like button, share with your fellow poultry keepers, and subscribe for more eccentric adventures. Until next time, may your nest be abundant and your eggs be aplenty. Stay clack.